Clay, thanks for coming, sir.
Glad to be here.
Yeah. My name is AJ Webb. This good? Oh, yeah. Sorry. Jess talks first.
Almost the doctor, so you could do it. Do you want to get that door? Awesome. All right. So, good evening. Welcome to tonight's segment of the Faculty Lecture Series. For those of you who don't know who I am, Jess Gallardi. I am professor and director, and I coordinate the series. So next week is our final week of lectures. On Wednesday, Peter Kostas of Art will be giving a lecture in the art building. Note the location change. And then next Thursday, we have a special guest presentation from Heather Hancock, who is coming in to work with music students and also presenting a lecture. So tonight's event is presented by Professor and soon-to-be Dr. A.J. Webb from the School of Business. Professor Webb was born in Mesa and raised in his words, dirt, sticks, and grit of Apache Junction, Arizona, making his way to Adams State on a football scholarship, earning multiple RMAC academic awards, and was recognized by the National Football Foundation for Excellence in Intercollegiate Football and Academics. Professor Webb is an alumnus from Adams State, earning a bachelor's degree in business administration and healthcare, and then started his 10-plus year career in the healthcare industry, during which he completed an MBA in leadership, also from Adams State. Professor Webb has taught at the college level since 2016, and 8 of those years at Adams State. AJ is finishing up his terminal degree at A.T. Still University's Doctor of Health Science program in the Organizational Behavior and Leadership program. AJ is fascinated with the relationship between groups of people working towards a common purpose and the effects on their health. So tonight's lecture is titled Jobs Well Done, Squared. What can workplace health promotion do for you? And in his words, this lecture expands upon previous lectures about wellness programs, population health, continuous quality improvement in health, and mental health. His previous lectures were largely influenced by his professional experiences as a community organizer for substance use prevention coalitions, wellness committee chair, recruiter, and wellness coordinator. In pursuit of his terminal degree, Professor Webb studied the literature regarding workplace health promotion, wellness programs. This lecture attempts to reconcile his professional experience with academic endeavors and chronicles his journey from engaged wellness champion to workplace promotion scholar. So help me in welcoming Professor Webb.
Now we're ready. Thanks again for being here. I appreciate you taking the time to come let me yap at you. I kind of have a big title here as far as like a promise, as far as me like delivering on what it is these things can do for you. And I'm hoping that I got a couple of punchlines for you. But I want to start with this. Now, I know Coach Wassinger knows what this is. But does anybody know what this is? We can start with guesses. Something from a parachute. That's a decent guess. Some type of restrainer. One more. Give me one more guess. Torture kit. Okay. All good guesses, right? No. This is a laundry loop. All right? So I figured Coach Wass would have recognized this, right? So this is a laundry loop. And even going back to high school, I was blessed to be a part of sports programs that had one of these dealios. And how this thing works, right? It's a very sophisticated system, right? You play your sport, you go to your practice, whatever it is that you do, and you take the shirt sleeve of your undershirt for your pads and your football pants and whatever it is, and you throw it through that loop, and you click it, and it's got a little section right here where they write your locker number on there or your playing number or whatever the case may be. And then this little jobber right here, this is not a super clear picture, so I apologize, but that little jobber right there, you take your socks and you put it in there, you clamp it shut, and then you throw it in the bin. And then when you come back to practice the next day, magic, your laundry loop's hanging up in your locker and you have nice, clean, dry clothes. Right? Now, my freshman and sophomore year of high school, we did not have such a thing. But Coach Max Ragsdale, who was my head coach my junior and senior year, he thought that this was something important and that it could support his athletes. Right? And that support may appear minor as far as, having clean stuff. Like, oh, you should just be able to, take it home and wash it and be an adult. But going home and washing clothes is a little bit trickier for me. I had, a bit of a chaotic household when I was growing up. And because of that, I kind of had a chaotic laundry loop every once in a while. I had every once in a while one of my t-shirts. And I definitely got a talking to the one time that I did put a pair of jeans on it. Okay? And the reason I bring this up is because this was one example of something that does not necessarily appear to have a whole lot to do with the process of winning a football game, right? But it was this tiny little support that extended beyond me having clean clothes or having clean gear for my practices. And I even got to take advantage of it and wash some of the clothes, like my socks and underwear and other things, right? So it was a part of our program, it was a part of our system as a football team that gave us access to clean stuff. So one, you weren't the stinky kid, right? And two, you felt supported just by having this little thing to help take care of you. Ooh, let's see. It's a laundry loop. One of many examples of supplemental support for student athletes. Some other gifts of being a part of a sports program that I was definitely the recipient of is I had the social support of my teammates. I had the social support of the community that I was involved in. I had some positive role models to look up to. I had some people that cared about me, the people that I got to spend time with. I had those same folks, or a lot of time, invested adults. They're invested in my success on the playing field, but also in the classroom. I had access to tutors, and other people had access to these things too. But again, just support systems around that. I had access to athletic training services all through high school and college. My head athletic trainer was basically my primary care provider. So if I got a fever, a headache, bumps, bruises, anything I needed, I had some type of health care to go and access. And through the whole process, you learn a lot about yourself, you learn a lot about your teammates, and you do something difficult. Okay? And these are all the blessings that are the kind of the fringe benefits, right? Because just looking at football, like, okay, what's your job? Go out there and win games, right? But I'm sure Coach Wassinger would attest, right? It's bigger than that, right? It develops character, prepares you for adulthood, and little things like a laundry loop that is like near and dear to my heart because that I needed it, I think are good examples of little touches in a group of people working towards a common goal that can help them feel supported, provide for some of their basic needs, and also just take one thing less out of the equation that you have to think about. Okay. Oh, and in that process, you're working towards a common purpose, right? Sport's been a major influence on my attitudes towards workplace health promotion, right? Not only was I required to show up to the games, represent my school and play, I also had to do practice, I also had to train, and there's a whole bunch of other stuff that I had to do that involved me doing things to support my own physical health and well-being, right? These are pictures of me doing those things. I was a scrawny little pup here in old 7th grade, and this is not a terrific picture because it's a picture of a pitcher at my mom's house. But you look at my elbow, and it's about that big a wide, right? I was kind of a scrawny runt in 7th grade. That's Coach Rich Milligan, who was my freshman football coach. A man who's near and dear to my heart, a man I look forward to seeing at graduation down in Arizona here in a couple of weeks. Was a huge father figure for me. I was involved in playing some paintball. That was a good way for me to go and earn a little bit of extra money and keep me busy on the weekends. And I met some of my lifelong pals, like my pals Justin, Raphael, Danny, and Eric down there. We were all seniors. This was one of our, I don't know if you'd exactly call it a football wellness program thing, but Coach Was, do you ever use a tire to remind your players to be on time or any other time they may deviate from the standard? Well, what I mean is like this was the tire that if you got in trouble or you lost a competition, you had to go flip that mofo. And as our senior prank, we snatched that tire up, we painted it our class color red, and we hung it up in that archway there in the middle. And so we thought that was a nice, fun prank, right? And that's a picture of myself and Dr. Anderson. And through the process of being involved in sport, which not only did I have the opportunity to participate in, these were all drivers, right? These extra things that I got to do in school that kept me eligible, that kept me earning C's and eventually B's. And by having these sports programs available to me, I was able to succeed in the high school environment, right? To the degree that this bottom right picture down here is when I signed my national letter of intent. Good grief, 20 plus years ago now, because I must have signed this sometime in February. And by participating in sport, having these folks take care of me, put me in situations to exercise, eat healthy, I got my opportunity to come here and play football at Adams State. So it opened up a new avenue that I didn't know that I was ever going to partake in or be a part of, right? And so these are pictures of me doing football-y type things. There's a good old picture right there of our newly appointed head coach Levi Gallus and myself walking out to a game, winning some trophies. And I was here to play football, but I also decided to take school pretty serious too, right? So, the elements that I got out of being a part of a sports team, they were also factors and drivers in me finishing my degree, doing okay enough to be recognized by the Hampshire Football Foundation. And I didn't know that this was going to be sent to me, but it ended up being pretty cool for a couple of reasons. One, I ended up being on the same list as Tim Tebow, and in most things I really have no business being on the same list as Tim Tebow, but when it comes to holding a decent GPA throughout your career and playing college football at a high level, that's something I have in common. And if you can't, I'm sure you can't see there, but Archie Manning signed that, right? Because he was the current chair of that thing at the time. So, pretty cool thing, and it leads up to multiple graduations here at Adams State. So, being a part of sports, being a part of programs, right? And I think that, I don't know, Coach Wash, you could correct me if you want, right? But, you have a football team, you have a football schedule, you go play the games, but when you start tying in all the little things together, like the academic support, the nutrition, the weights, the laundry loops, and these other types of things, you develop a program, right? And a program has a long-term goal in mind and a series of strategies and tactics to help you achieve that. And I bring that program part up because when I think about workplace health promotion, it can just be a thing that you do, but you put it together proper and you build around it appropriately. I think you can turn it into a program, something with some with a long-term vision, a long-term aim that you might even be able to measure a thing or two with it. So the objective for this faculty lecture is probably not going to be anything like, I'm going to do my best with this, right? But mostly I've kidnapped you so that I can give you an ear beating about what I've been up to with my scholarly deliverables recently. And I'd love to tell you that I have like some super profound finding or punchline at the end, but mostly this is for me because it gives me a good opportunity, and I'm very blessed to have Jess include me in these faculty lecture series, especially across, I think this is my 5th or 6th one now, because it's been a pause and an opportunity to reflect, look at how my attitudes about certain topics has changed, and also look at my growth as far as understanding these things and even maybe get close to applying them here on our campus. So my previous lectures were about wellness programs, population health, CQI, continuous quality and improvement in health, and Jess and I even got to tag team a conversation about mental health and higher education, and a lot of that has been extremely useful in putting me in the position now to where I'm getting really close to completing that terminal degree. So what I'm going to do is I'm going to connect some of the dots, mostly for my own self, but we'll see if they'll end up being relevant for you too. Chronicling my journey from engaged wellness champion to workplace promotion scholar, basically saying this was a thing that I liked because it seemed pretty similar to some of the other things that I liked, and really taking a deep dive into it and understanding, like, does that stuff even work, right? And is there a body of evidence that suggests that it works? And if it does work, could you do it here? Could you do it here on the Adams State campus? So I'll be reconciling my professional experience with this academic journey I've been on for my terminal degree, and then we're going to take some peeks into the literature. And that, I had kind of designed this to give last semester, but I got a little busy, got a little worn down, got a little involved, and so I had to punt it to here. So I'm kind of bridging that gap a little bit. Okay, so I'll go through some of my professional experience with workplace health promotion, some of my relevant healthcare experience, and some of the things that I've drawn out of that, and have now developed some academic insights into it. I'll talk a little bit about the President's Commission on Employee Wellness, which has been kind of a godsend for me. As far as a year ago, President Tanberg saying, hey, we think we'd like to do some stuff with employee wellness, and that was actually a thing that I thought maybe that ship had sailed as far as me being able to actually do some research around employee health and well-being, but we got something started up. I'll peek into that literature review a little bit, and I'll talk about some of the next steps as far as I don't know, things that I would like to have happen, maybe my next faculty lecture series, as far as maybe reporting some results, talking about this survey that I built and sent out, and the analysis and whatever it is that I might find in there. Okay? So I started my career at the San Luis Valley Behavioral Health Group. I was just getting ready to wrap up. I had finished my last year of football in the fall of 2009 and decided to stick around an extra semester because I needed to do an internship as part of my degree track. I'd also just met my girlfriend at the time, but it eventually becomes my wife, Jolene Webb. And I started working at the San Luis Valley Behavioral Health Group. And when I studied healthcare administration, my ultimate conclusion was you should probably stay as far away from healthcare as you can if you can, right? And that's not to throw shade on that system, because there are magical things that occur in the healthcare system. I go to church with a little girl who would have died at 6 years old, but she got a heart transplant, right? And that's magic, right? So there's magical things that happen in our healthcare system. But there's a lot of treatments, there's a whole bunch of stuff that happens within that healthcare system that could potentially be avoided, right? Especially when we start talking about chronic illness, and things that can be addressed via lifestyle changes and lifestyle interventions. Okay, and so when I got this job as a community organizer for the Substance Use Prevention Coalition, I didn't really know too much about health. Like, I knew quite a bit about healthcare administration, but I didn't know about things like public health models, the difference in the tiers of prevention, and then what do communities actually do to attempt to influence positive, we'll call them protective factors and risk factors within a community. Okay? And so pretty steep learning curve. I had my businessy type background, so I was pretty handy at presenting, I was pretty handy at putting good promotional material, I was pretty handy at managing projects, but I really didn't know how the whole health thing really worked, because that's not really what I studied. I studied the healthcare part of it and the administration part of that. And the idea around preventing substance use, right? So the use of alcohol, the use of tobacco, was not so much around, the finger wagging, and this was, this moral issue that we were to address, but there's some pretty strong evidence that suggests that you get into those things early on in your life that they can have some long-term repercussions, whether that's lung cancer way down the road, dependency on certain substances, fracases with the legal system. And so the whole thing wasn't wrapped around just, hey, don't do these things, these are not good. It's, hey, let's see if we can reduce some of these things and move towards this, right? And when I say wellness, and wellness is an easy thing, similar to exercise, that you bring it up, and if I say exercise, maybe Professor Vernon's thinking about running, right? And maybe Professor Goulardi's thinking about taking his walks. Maybe Coach Wass is thinking about hosting, real intense weight sessions. Could be yoga, right? So when you think about exercise, it could mean a whole bunch of different things, right? This is the definition that I've hung on to, and really kind of focused my scholarly endeavors around, right? So rather than considering wellness this state, like I am well because my head's pretty good right now as far as my emotions and my thoughts, and my physical health is pretty well because I got my blood sugar under control, focusing on it as a process rather than a state. So conscious, this is wellness defined here, got this from SAMHSA, which is the Substance Abuse and Mental Health Services Administration, a conscious, deliberate process that requires awareness of and making choices for a more satisfying lifestyle. So we're not just trying to get folks to not engage in these things because they're bad and they cause problems. It's because they interrupt this, okay? And this is not just the absence of disease, illness, stress, but the presence of purpose in life, active involvement in satisfying work and play, joyful relationships, a healthy body and living environment, and happiness. Right? So, rather than focusing on wellness as a state, I focus on wellness as a process and treating it almost as a set of skills, right? Because the awareness piece, that can be a set of skills that someone develops. The dumb AJ version of this is wellness is knowing what you need, when you need it, and where to go get it. Okay? That's the real simple version of it to me. And that's not necessarily an easy thing to do. And the environments that we live in, that we work in, that we share with other people, there are some factors that can influence whether we're able to do this or not, right? Down in Arizona, like going outside, most of the time, not such a big deal. Here, a little bit different, okay? Especially when it gets cold, snow, sleet, all those different types of things, okay? Now, what do you actually do, okay, working in prevention? This is a picture of me at Cole Park on Kick Butts Day, where we took a bunch of middle school students down to the park, and their deal was they wanted to clean the parks up, especially regarding like the tobacco-related product after effects and stuff and things that gets left over, right? And so they wanted to go talk to city council about this. They were looking to develop an ordinance to where you would basically have a tobacco-free park. But that seemed a little bit excessive as far as requiring the police to enforce something like that. So they were really just trying to make a pitch to get some signage that says this is a smoke-free zone. Not as a judgment towards smoking, but as a way to say, hey, let's not have cigarette butts in the sandboxes where little Jimmy and little Johnny and little Jenny can, pick those up and eat them if they're toddlers or whatever the case may be. This is, at the time, that was Mayor Burvig. And we went down and recognized him for his support in this underage drinking campaign called Parents Who Host Lose the Most. These are some table towers, some things with some fun facts about this and that we will put out in the community. Had plenty of meetings. We helped host After Prom. And I always enjoyed being a part of hosting After Proms. It basically gave the prom goers something to do after prom, right? So rather than going to a bonfire in the middle of a field and, drinking a couple Sixers or something like that, they could go and see a hypnotist. They could win a mini fridge for when they go to college, get some DVDs, because that was important in 2010. So those are some of the things that we were up to, right? And as I kind of finished up my undergraduate degree and my internship there kind of turned into part-time and then full-time employment, I started working in the MBA program. So I started studying, started business at the master level, and I needed some things to write about. My concentration was leadership, and I decided to start focusing on health and well-being in the workplace. And this is a nice bucket book that I found. And when I say bucket book, the School of Business used to have this big, bin. Bin's probably a better word to describe it. And they would just put books in there. And I found this one in there. And this is about a company named Pitney Bowes. And I'm not entirely sure what Pitney Bowes was up to at that time, but they wrote this book, Total Value, Total Return. And I framed one of my leadership papers around leading healthier organizations, and I wrote this in 2012, okay? So it's 7 rules for optimizing employee benefits for a healthier and more productive workplace, okay? And so what that got me thinking about was like, how important is our health insurance as a benefit in the workplace? Because that's got some direct costs associated with the lack of wellness or whatever burdens of disease that might be caused there. And just kind of got my gears turning on, okay, this is why something like this could be important for a business. This is also around 2010-ish. There was some new stuff coming out as far as policy. That was when the Affordable Care Act was passed. And one of the provisions in the Affordable Care Act was employers were now able to support employee health via offering wellness programs. And that meant that with no tax penalty. You could offer incentives. You can offer rewards to say, hey, let's go for walks like in the workplace and make them a part of the work environment. Okay. This was a book intended to address healthcare inflation, decline in the U.S. health population, shortcomings of managed care, and the complexities of, because health insurance is kind of a misnomer, right? Like typically insurance means you get covered in the case of a catastrophe, and most of it's covered where, like that's how your car insurance works, right? But your car also needs maintenance, just like people also need maintenance, going in, annual checkups, dental visits, stuff like that, okay? It talks a lot about some of the consequences of shifting healthcare costs to employees as far as basically, since it's more expensive for employees, they have to ration it themselves, so they're foregoing some type of medical treatment, and that ends up being a really big deal for our middle class because they have this is very similar to the house that I grew up in, right? We had health insurance, we were blessed to have it, we just couldn't afford to use it. So I don't know if anybody has ever gotten the like, hey, when you go out to play, like don't get hurt spiel, right? Pretty common spiel. Like my mom really meant it because it was going to be a real issue. Because I don't know that we had an extra $2,000-3,000 to cover co-insurance and co-pays and stuff like that. And then what I pulled from this and I've kind of drawn in is working to address these things strategically and pragmatically. Okay, so strategically, broad ideas with tactics underneath, and then ideally having something to measure so that you know that you're actually making a difference in it, and then pragmatically, like understanding that workplaces are full of a whole bunch of different people with a whole bunch of different needs, and not everything can be like this gold standard randomized controlled trial scenario where the thing works. You have to tailor things. Okay? The 6 points out of that book, 7 points. The healthy organization begins and ends with your people. To realize total value, you must understand total costs. Higher costs do not always mean higher value. Health begins and ends with the individual. Avoiding barriers to effective treatment. Okay. Again, back to that Affordable Care Act. One of the things that, in its attempt at starting some healthcare reform is it made it so that you couldn't charge a copay for annual wellness exams and preventative screenings, right? They removed the $25 or $35 financial barrier so that you could go get a mammogram, so that you could go get a colonoscopy, so you could go see your doc on an annual basis, okay? Carrots are valued over sticks, all right? Not uncommon for a health insurance plan to be set up in a way that this is what you pay, but if you do this, you have to pay more. And that's kind of a carrot too, but for the most part, trying to avoid punishment and give people positive things to work for. And the total value requires total teamwork. So it's not just an HR thing. It's not just an operations thing. It's not just an individual thing. It takes an entire system to address a very complex problem. Okay? How I attempted to use wellness programs strategically was when I became a recruiter. I got to be a part of the wellness committee pretty early on, and they said, hey, do you like to exercise? And I said, I do like to exercise. I've been doing it, and I like it, and it's good. Okay, would you like to be a part of our wellness committee? And the wellness committee, I would describe as being pretty crude, right? Well-intended, but like put fruit in the break room. Like that's what we did, so people had a healthy snack. You could maybe pass the vending machine with a Snickers bar in it, snatch yourself up a nanner, but ultimately like a strategy and a tactic that it would be really difficult for you to ever at any point say, ooh, we've made things better around here. Where we kind of started to increase in sophistication was running a couple of challenges and participating in some cross-business challenges. So we'd get a bunch of businesses together that wanted to do this Coming Alive challenge. And the idea was you'd track your steps and you would do certain things and record stuff, and the businesses would compete. And that was my first exposure to gamifying these types of activities, because now This is the average Joes, right? So not only were we competing against the businesses, we were we did some interdepartment competitions, right? So we leveraged, for some, the competitive nature of people and some teamwork to get them engaged in this, and it seemed to be a little bit better than, hey, everybody, we're playing this game against Valley-wide health system, so go do these things. We got to play against each other internally. And the big eureka was Pinnacle Assurance, who provided the workers' compensation insurance for us. They said, hey, we have this new application-based wellness program. It covers physical health, mental health, nutrition. It covers a whole bunch of stuff. And if your company wants to use it, you can use it for free because there's a strong association between the health status of a population of employees and how many workers compensate. There's safety, basically, right? And so that kind of exposed me to like, oh, okay, so someone's willing to pony up some dough for this. Maybe there's something to it, but it also was much more engaging and intuitive and manageable for me as the wellness coordinator, the wellness chair there, because this gave me back-end analytics on a regular basis, and I no longer just said, hey, let's do this stuff. We could do something and then see that the average steps per participant had engaged, which isn't, hard lined into we just saved a whole bunch of money on medical claims. However, it gave us an opportunity to manage and measure process measures, right? Because the process measure for some type of a health outcome is exercise. So we got a beat on what were people doing on a daily basis. Okay? Now, that particular program was super fun. I really enjoyed implementing that, and I implemented it as a recruiting and retention strategy over at the behavioral health group. And so when a gig as a full-time wellness coordinator opened up at San Luis Valley Health, who had about $500,000 a year dedicated to employee health and wellness, I took that same application, which was available because they also use Pinnacle Assurance, and we implemented over at San Luis Valley Health. And we went from a wellness program that consisted of me managing a spreadsheet. Anybody here had to manage a spreadsheet before? I really appreciate spreadsheets. I do enjoy building them, especially if they solve a problem. Managing them on a day-to-day and a weekly basis, not exactly my cup of tea, because I'm just not built that way. I don't have a really great reason. Maybe I'm lazy, right? And we went from people would just go and do a whole bunch of random stuff, and then I would do my damnedest to keep track of it, and they would get a check cut to them at the end of the quarter for going to see the dentist, going to see the optometrist, doing some preventative visits, whatever the case may be, to this application that gave us stuff on the back end where we could measure the amount of engagement with that particular platform. There was competition built in, and that whole experience really gave me an appreciation for technology and the way that you can get an up-to-date kind of dashboard around what's going on. And it made a pretty abstract thing that's very hard to manage the middle part of it. It at least gave you some tools to work with. Okay. Now, sorry this is cut off. Okay. This is how I approached that job. Okay. Was thinking about the 5 buckets of healthcare claims. Okay. And so basically, if you got to go use your health insurance, it's for one of these reasons. Okay. Toxic, you've been poisoned. Okay. Kinetic, you've been hit by a vehicle. This is unfortunate, but now you got to go use the health insurance. You've had some type of an impact trauma. You fell down. You crashed your mountain bike, something like that. Genetic, mom and dad just passed down the gene that gets you this, right? And then microbic, and that has to do with getting some type of an infection. These 4, outside of like maybe some risky behaviors in one of these areas, these 4 are really hard. These 4 are really hard to predict. Okay, if you got a crystal ball and some magic powers, you might be able to see into the future to figure out whether or not one of these is going to pop up, right? But the chronic illness bucket, there's a bunch of that is preventable, and it also accounts for the highest proportion of costs. And one of the most potent ways of dealing with this is through lifestyle intervention. The hard part is that it's lifestyle intervention, and that's one of the hardest things to do is to get people to change their behaviors, right? And this isn't like a judgment thing, because it's real easy to, well, we live in a world that's pretty easy to engage in eating a whole bunch of calorie-packed, delicious kinds of things. Most of us, I'm going to guess in here, Buck, how often are you sitting a day? Yeah, right, 6 hours, right? So between the demands of the contemporary office environment, the availability of stuff, easy access, super fun entertainment, moving around and eating healthy stuff is at times a little bit harder thing to do, especially habitually, right? And thinking back to some of the stuff I showed you, it hasn't been as big a challenge for me as far as maintaining a healthy body weight and exercise and eating right. But I've been working on that shit since I was 14 years old, right? Like I was taking a sand dumbbell off of my bunk bed so that I could throw the ball harder as a catcher on my little league team. I had coaches telling me, eat son, you need to have a slim fast at every meal. And so because of the sport and things that I was involved in, that was part of the culture of those groups, and I was exposed to it at an early age and almost required to do it for most of my formative years. So by the time I hit the workplace, I have to make the necessary adjustments to sitting a whole bunch. I have to make the necessary adjustments to workplace stress and wanting to go home and have a few barley pops after a Wednesday or something like that. But for the most part, I had a whole bunch of training and experiences to help me develop a whole bunch of healthy habits, right? So chronic conditions claims can be the most costly from a claim standpoint, and they also, these are particularly miserable because they have a high burden with them, right? Feeling poorly, right? I do have a couple of chronic conditions. I'm pretty sore often, right? Joints and stuff like that, being in an airplane, and these are some of the consequences of playing sport and all the exercise. But it's a little easier for me to cope with them, right? And that's not the case for everybody. So fortunately, we can do something about chronic conditions, okay? How? All right. This is where I'm starting to draw in as far as some of my academic overland with the things I was up to. So when we approach substance abuse in a community, we would use logic models, right? And so we have this outcome over here, which are claims for chronic conditions. We would be interested in knowing what are the key risks for those particular conditions. Are there protective factors, right? So for me, managing my body weight, having been exposed to exercise through my formative years, I would describe that as a protective factors. What are the risk factors? Well, risk factors for me is playing sport is I hit my head a lot. Had to lift heavy stuff, got chop blocked a bunch of stuff, and then we can start figuring out what are the interventions that can increase these protective factors, decrease those risk factors, and potentially decrease those risks, and maybe we get the output here, right? What's hard about this and why prevention is not a particularly sexy thing is when you prevent something, what happens? Nothing. It's ultimately a not particularly glamorous punchline and end of the thing, right? There's also the element of uncertainty because maybe that wasn't going to happen anyway, right? So it's difficult. So here's a couple examples. These are logic models that I use over at SLV Health. Percent of individuals that do not complete routine wellness visits. Individuals do not have a formal primary care provider, right? So we got people, they have a free or no cost to them annual wellness exam, but they don't have a relationship established with their primary care provider. So I played primary care provider matchmaker over at San Luis Valley Health, doing biographies on all the different the primary healthcare providers that were available in that system. And so, someone like me, I read the biography. We got any Ed Culp patients in here? Oh, okay. So Ed Culp, another former football player. Maybe I jive with him and I'd like to go see with him because he's another bigger-bodied fella, knows the consequences of the gridiron. And then, so we played PCP, not the drug, primary care provider matchmaking. Okay, here's one. Elevated hemoglobin A1C, pretty good way to work on that. Exercise, diet, having some healthy habit challenges, right? Where we challenge people to eat vegetables on a regular basis, and who knows whether or not that sticks and eventually makes it over here. Not a perfect toolkit, but I think it's better than nothing, okay? Things that I was good at as a wellness coordinator over there, okay? What I was good at was generating engagement, teaching people how to use the platform, getting challenges going, creating some excitement, doing some promotion, using my cult leader charisma and my willingness to jump up in front of a crowd and say some shit out of pocket. Totally okay with this, right? I was good at getting people to use it. What I was not good at it was approaching this like a researcher, okay? Because what I had over there was a quasi-experiment, right? I would have had some type of a control group in the people that signed up, completed a health assessment, but they didn't do any of the participation in things, and they also completed a biometric screening. And then I had the people that did, and I could have compared those things, except for I didn't know how to research. And when I say research, like I didn't know how to compare two groups, didn't have the stats, chops, and that's been one of my like revenge pieces of doing a Doctor of Health Sciences degree, is figuring out, oh boy, what could I have done to figure out if this engagement meant anything? Now, I still have people that I see walking around that when I bump into them, they say, hey, thanks for the wellness program thing. I've been walking this whole time. I've lost some weight. That's not a ton of people, right? That's happened like 2 or 3 times. So I know it's done something, or at least I believe, right? I don't have data to support it, right? And so in God we trust, everybody else bring data, okay? Over there, I also work to align outside of probably what was my scope of work, okay? I could have probably made a nice, tidy career doing funsy things that people enjoyed and people would have positive reports about the wellness program, but I was pretty sure that the program was supporting the laboratory because we were doing 400 biometric screenings every year, and we paid for that through some insurance, so that was probably desirable for them. Through the marketing team, right, we get to say, hey, we're SLV Health, and we're doing these healthy things because we care about our employees, and that's a decent thing when it comes for, I'm sure, human resources, recruiting. I also found it extremely interesting, despite that being a group of people working in healthcare, the amount of them that didn't have primary care providers and that didn't abide by the basic recommendations which they like sold on like a regular basis, right? Good examples, has anybody used a personal health portal before? Yeah, so Alex, yeah? Can't do anything without the damn portal, right? They are not super user-friendly at times, right? And that, because they're a pain in the ass, someone might just skip using that damn thing, right? Which seemed to be most of the case. But you got some pesky mofo like me that knows how to make a video or two, who can put together some decent walkthroughs, and then force everyone to sign up for the portal, because that's where your biometric screening health results were going to be. People got in, they said, yeah, that thing sucks, but it's really not that bad. And I feel more confident in recommending it, like genuinely and authentically to my patients to use it, compared to just saying, yes, and here's the card thing for the portal thing, whatever that damn thing is, right? So this is a wellness program value-adding activities, right? This is a linchpin, typically holds some stuff together, and this is me trying to go above and beyond what my scope of work. Then I got the teaching bug, and the teaching bone is connected to the go back to doctor school bone. So, stopped working at SLV Health, committed full-time to the academes, and one of the pieces of advice that I got, because I was shopping for doctoral programs, and I was looking at this one, and I was looking at this one, and I was like, oh, should I do a Doctor of Business Administration? Should I do it in organizational psychology? The advice I got was, don't pick something that you don't really care about, right? Like pick something that's really, really interesting to you. And I had a bone to pick with myself and saying, okay, I think there's something to this employee health program thing, but I'm not prepared, skilled enough. There's nothing stopping me from maybe figuring out how to do a proper experiment. But that's why I chose a Doctor of Health Sciences degree. Okay? Alphabetically, A.T. Still University popped up at the tippity top. Okay? And what they make their chops in is A.T. Still was a gentleman in, I believe, Missouri, who started the first Doctor of Osteopathy school, right? So if you go into your doctor's offices, you'll see different credentials up on the wall. Maybe you saw, who here's gone to the doctor's office, but you didn't see a doctor? Like you saw the nurses and stuff, but you saw, Ed Culp, right? Ed Culp's the physician's assistant, right? So he's a mid-level type provider, right? Now, when you look at the doctors, you'll see DOs and MDs. DO is Doctor of Osteopathy, and they got a little bit different get down. This is going to be crude, and if there is a doctor in here, I'll tell you what my car is so you can go key it. But the Doctor of Osteopathy is looking at the person and their skeleton and their muscles and how everything works, and kind of has this general assumption that if you get the whole body back into homeopathy, like everything's playing nice to each other or with each other, that you typically get better, right? And they even have some kind of chiropractic moves that they made the cut for medical licensure, but chiropractors didn't. MDs are doctors of medicine, right? Things go in your body. What does that do, right? So OAT still started the first, is it like 100-something years ago, and I really like their mission about this whole person health. And they also had an offshoot of their medical and dental schools called the College of Graduate Health Studies, and they had a program called Doctor of Health Sciences. And when I read through it, I liked what the organization had to say about itself, and I applied, got in, and I've been grinding on that since January of 2021, okay? And my intention, initially and now, but they had a little middle adversity there, was studying the relationships between employee health, wellness, and an organization's performance, right? Because my thing that I believe is that if we're all in a workplace together striving for a common purpose, that we might inch a little closer to that if we're doing a good job of taking care of ourselves and taking care of each other. And we're aware of all the benefits and the resources that we have at our disposal. And maybe we even modify our environments just a little bit to make healthy options easier, right? Or we can just not kill ourselves making a living, right? Especially in the knowledge worker context, okay? When I first started working on my papers, I still had this wellness program bug, and I started looking at burnout, because that was my boogeyman over at San Luis Valley Health, right? Popular term, everyone's talking about burnout, oh, I'm so burnout, and I found out that that actually has like a definition, right? And that it's this occupational phenomenon, right? It's associated with your workplace, and it's a cluster of symptoms, right? And that's depersonalization, okay? So in the case of healthcare, what that means is this is no longer Alex Vernon in room whatever. This is the plantar fasciitis, right? So depersonalization, emotional labor, right? You got to do the things that you got to do at your workplace, but it's really, really hard because you got to muster up the courage, and it's like having a difficult conversation every day. It takes an emotional toll on you, and another component of that is moral injury, right? And in healthcare, one of the things that seems to be the case is that, who knows some doctors and nurses and healthcare type people? Okay? Alex, Professor Vernon, do you find them to be generous and helping and really are interested in helping people? Until they got burned out, right? Because my experience with folks that work in healthcare is like they're saints. Like that's like a natural resource that ought to be protected. And they get themselves into a system where they're really interested in helping people, and they spend a lot of time clicking stuff they have to deny claims, and they have to go through, and they have to get pre-authorizations, and they're caught up in a system that hurts their feelings because they signed up to help people, but the damn insurance won't do da-da-da-da-da-da, or we got to use this stupid electronic health record, and so I'm over here like a glorified typist rather than looking at my patient in the eyes, talking with them, feeling their pain, and being a healer for them, right?
Did you do any comparisons with that burnout, especially during COVID? Because that's where some
Oh
people are
boy.
leaving the profession.
So COVID made it worse, right? And I got a couple comments on that too, because in 2019 they published, and one of the main sources for me in writing that paper was the the National Academies of Medicine, Science, and Engineering had published a big paper, and that big paper was all about addressing clinical burnout, why it's a problem, and might have been the next big deal had we not had COVID, and that kind of derailed things. Now, COVID made things worse because there's a whole bunch of uncertainty and scariness, a whole bunch of regulations and things people had to do, and there was a mass exodus. So burnout made it worse because it was scary, but also a bunch of people said, I'm out, and they retired early, they switched professions, there's a bunch of stuff, right? So that's a really good point. I'll be curious to see if they got some updates, right? Because ironically, it's like personal health and well-being should be like the most important thing during COVID, but you don't have the dough coming in from elective surgeries, we got to cut some programs, okay? I started looking at revisiting leadership styles as far as leading a healthier organization. What are the characteristics of leaders? And then I started looking at improving quality and safety using stress management programs and psychological safety. So this is where I started kind of tying these two things together, or tying like a systematic approach to doing something about it and knowing whether or not you did something about it, to this kind of belief that we should take care of one another, right? And so this one had to do, I wrote this in my risk management class, and I basically advocated for some type of stress management and adjustment to policy programs to help providers cope, because the consequences of burnout in healthcare are a big deal, right? It's bad for the doctors and the nurses because their physical health declines, they're not particularly satisfied, and because they've now depersonalized emotional labor and this other cluster of syndromes, or other cluster of symptoms, they're less meticulous, more likely to forget. There's data that shows that they are at an increased likelihood, if they're experiencing the symptoms of burnout, to have errors and get sued for medical malpractice and a whole bunch of other stuff. So this is where I started playing, okay, wellness is this thing, and I'm a hammer, and the whole world should do that. But burnout's a thing, okay? Why is burnout bad? Well, burnout's not good for the employees, but it's also really not good for the patients, and not good for the system at whole. And is this a potential, is this one of the interventions that could be used to address something like that, okay? And I also wrote about wearable devices as a means for predicting employee stress. I got really interested in increasing the amount of data that you had, right? It was very interesting. In 2019, I was using the Fitbits, and they sent me an email that said, would you like to participate in a study where we're going to take heart rate variability, and we're going to see if we can predict flu outbreaks? That was really interesting to me, right? Because now you got a gizmo that's tracking some stuff on a pretty regular basis. When you get sick, there's a change in your heart rate variability. And so what they wanted to do was aggregate all that data, and I was all about it, because I think that there's a bunch of potential upsides. That's if they give you one, right? That's if they'll give you one, right? Okay. This also kind of ushers me into this series of lectures, and now I'm on my sixth one, right? I started with this Jobs Well Done. I don't know if you went to that one, Vernon, or another one after that, but that one was not good. Just rough.
Starting fall 22.
Fall 22? Okay. Oh, wellness is organized. That was a little bit better, right? And this was basically like, hey, organizations that have listed wellness and well-being and health and safety as an organizational value, you've listed it as a value, what do you do about it, right? And I'm excited about something that's going on in the Adams State campus, right? There's been a crack team working on the strategic plan, and they've been kind enough. I think it's just a favor to me, but they've integrated health and well-being into that value set. Did I got that correct, Jess? Okay. That one was a little bit better. Now, I started focusing on the mental health, but I also made a pivot in this one because I didn't think that I was going to get a shot at, I didn't think I was going to be able to access an employee population. I could run amok over at SLV Health, but we didn't have a wellness program here. It wasn't something that was being talked about. And I started pivoting into student athlete health, student athlete mental health, student mental health, thinking that I'd be down at the training room handing out surveys and collecting some data around, injured student athlete mental health or their perceptions of the support systems or something like that. And I haven't put that one completely to bed because that one's near and dear to my heart too. But old Tanberg approached me last year. So that's President Dr. David Tanberg, and he says, hey, Kyle Glenn told me that you've got some experience with wellness programs and wellness committees, and we'd like to get something going here on campus. I'd really like to, get people moving. I'd like this to become cultural. And I've talked to a lot of head honchos that wanted to talk about wellness programs. Most of those conversations, I'd say 8 out of 10, involved a discussion around cost management, which is a valid discussion, right? I don't know that you can pull it off. So maybe that's a spoiler to the end of this thing, right? I don't know that you're going to be able to definitively prove that you reduced your amount that you spent on claims, right? I'm not saying that can't be done, but that's pretty complex. And when I talked to Tanberg, to him, it was a moral obligation because employees spend most of their day here. They're not with their families, right? They might be sleeping, but other than that, you spend a lot of time here at work, and there's a lot of influences that the work environment has on our personal health and well-being, right? And this to me was like this eureka moment, and there was part of me that had regretted abandoning like employee health stuff because then I had to get busy writing a literature review on something that I hadn't really been reading about for a couple of years. But I got it going, right? Now, with Tanberg approaching us and saying, hey, we want you to start this. Raina Kirkland's going to be a chair. We want you to get together a wellness committee. And then I had a conversation with him around like, what are your expectations around this, just to kind of clarify what exactly the charter and the marching orders was. But he said, let your freak flag fly. And so what I proposed to that committee and what we adopted was using this model right here. And this model is very similar to the model I used in substance abuse prevention. The substance abuse prevention model I used was called the Strategic Prevention Framework. I guess you call it a framework, not a model, right? But it had 5 basic components, right? Assessment. Oh boy, I'm putting myself on this. Assessment, capacity, strategic planning, implementation, and evaluation, right? This model right here gets used by NACHO, and that's like the National Association for Counties, something municipal, I forget the whole thing, right? But it's this blueprint, so to speak. Say, hey, you got a group of people and you want to make them healthier, follow these steps. And these steps are organize for success, where you're partnering and co-aligning, right? Who do we got to get on the bus to address this, right? Because I could wellness coordinate my face off. But if I don't have Tanberg's backing, if I don't have Savala's backing, so that's the president, as far as, soliciting some funds or something like that, translating this into, okay, this is the employee wellness committee, like how's that good for students and how's that going to be good for, whatever it is. So we put the super team together and we partnered up, okay? That group last summer spent a lot of time sitting down, crafting a vision, crafting a mission, creating its own charter, right? And now we've come to step 3, and this is where it starts to pick up for me as far as doing a literature review and starting to figure out what the hell can we do about this? Can we do anything about this, right? And if we did something, how would we know that we made a difference, okay? So define wellness. Did a couple of activities last semester. One of those involved drumming up. We had an epic victory. Coach Wass, you'll like this. We had an epic victory over Western State, President Tannenberg called down the thunder and challenged Western States President something Baca, Dr. Baca, President Baca, and said, hey, whichever school can get the most employee participation in the biometric screenings, the loser has to wear the other school's shirt. And we ousted him by like 10 visits, and so epic victory. We beat Western Coach, right? And then we took some walks, started to build a little brand recognition, started talking, like trying to develop some excitement, and then we, rolled some stuff out, okay? This was the vision and mission that we came up, or this is the mission and values that we came up with. Make a positive difference. That's a shout out to Marty right there, Coach Was, to make a positive difference in the wellness of Adams State employees through delivering a comprehensive, evidence and data-informed, culturally competent, inclusive wellness program. That's a mouthful of stuff, but it comes down to mostly this part right here, like make a positive difference, okay? And do it in a way that people are receptive, participative. This isn't the donut police, okay? Being a wellness coordinator, I had a lot of really fun interactions at the grocery store, like people coming up, looking at my shopping cart, and people going, taking their shopping cart away, and I'd see them in line, and it was so bad, don't look at my cart, it's so bad, like this is not morals, right? But to do it in a way that like, we're not trying to, like, this isn't to alienate people, shame people, right? Let's just make this a little bit better place to be. So we cooked up some values, cooked up a vision, right? And in the process of creating that vision, right, this idealized future campus, okay, my axe to grind was we could just say that these things exist and maybe believe them, and we can all drink the Kool-Aid about it, or maybe we can get some recognition, okay? So does one of these point a laser?
Yeah, the top one.
Hiya. So these two awards right here, one of them is around health, overall health of an employee population. The other one's involved in mental health, right? So this is the C. Everett Koop Award. C. Everett Koop was a Surgeon General, big time into data, and they named an award after him. And basically what you do is you apply to be recognized, and what you have to show is that you improve the health of your employee population and that you improved the business outcomes, right? So twofold thing there, right? Like you did better in moving towards your mission and you made people better, right? And I'm sure that there's some shenanigans that you could go through to, cheat a little bit and figure that out, right? But for the most part, those are two things that I was interested in doing. Like, can I make this like bottom line better, and can we have some definitive or semi-definitive evidence that people's health outcomes, people's health status has improved, right? And this is a tragic story. The Bell Seal, there's a gentleman who was fired from his job, and that gentleman took that real hard, because firing is a real hard thing to take. That gentleman had been experiencing a series of otherwise pretty obvious declines in their mental health, and that individual ended up doing, we'll just say that they did something violent, and some people lost their lives, and it was not good, right? And in memory, Bell Seal was one of the persons that lost their life. In memory of that individual, same gig here, except for it focuses on mental health, right? So in regards to a vision for the President's Commission, this is a BHOG, big, hairy, audacious goal, big, nasty thing that I will find some extreme satisfaction trying to get Adams State that award one day, okay? Then I started a literature review, and boy, oh boy, are those a peach. And that basically means that you're supposed to go and find all of the things that you need to know about a particular topic, and you need to synthesize it down into some of your own thoughts, but mostly you can reference everything. And one of my scholarly mentors described this as this necessary evil, okay? And it was hard, right? So I started working on that last summer, right? And it was little overwhelming for me, right? Because I had really started to dial in my working knowledge of the literature on student-athlete mental health, injured student-athlete mental health, and then I was pivoted back into this, and I had to figure out a place to start. And so I started with a working title: Assessing an Employee Population's Health and Well-Being to identify strategic issues and inform worksite health promotion program design and evaluations. Is a shit title. It's long, right? But the reason that I was aiming towards this is because that is the next step, right? So you partnered up, you've crafted a vision and a mission. Now you're going to go ahead and do some assessments, right? And those assessments are right here: community themes and strength assessments, local health systems assessments, community health status assessments, and then forces of change assessment. Okay, and some of those are pretty difficult. Okay, but in reading the literature, what I wanted to cook up was, hey, what's available out there so that we could pull some of this off, right? What needs to be created from scratch, possibly, and what's already existing on campus, okay? And ask myself, is this even doable, right? So I had to start reading papers, just semi-terrified that, like, oh boy, there's going to be papers out there that say that this is a great idea, and there's going to be papers out there that say that this is a bad idea. And I was right on both accounts, right? Where I started, and I guess if I had to say I fall into a camp, is a gentleman named Ron Goetzel. Now, Ron Goetzel is the director of the National Institute for Employee Health and Productivity Studies, and I think they're running out of Johns Hopkins now. The reason I started with him is because I got to see him present live at a conference, right? And one of the things that he wrote about is, what do wellness programs do? Okay, and according to him, wellness programs work, ... when they're done well. And then he defines well as, you build an evaluation plan, you tailor the interventions to the population, you address the most important issues, you pick the low-hanging fruit, so to speak. But there's a lot of other people that said that wellness programs are a joke, right? And one of the reasons they said that wellness programs are a joke is because they were attempting to use randomized controlled trials. And that seems to be a really difficult thing to pull off, because that RCT, that randomized controlled trial, is the gold standard on whether or not something does work. And that seems to be really hard to pull off in an employee population. So that was semi-tragic, but I decided to just stick with my beliefs on this thing and look at some of the literature that Goetzel had reviewed, and that's where I started, right? So I started in Goetzel's camp. Now, Goetzel also published a practical guide to developing, implementing, and evaluating employee workplace health promotion programs, and that really helped me bring some structure to how I think about this. Okay, and one of those things is, all right, the success of your employee wellness program. You got two factors you need to consider, and they both have sub-factors. First factor is individual health risks, right? What's going on with the people inside your population, right? The other one, which is the thing that the President's Commission on Employee Wellness can do something about, are workplace health promotion factors. And so that involves the environment, that involves the culture, that involves the availability of resources, the communication, a whole bunch of other sub-factors. How are we doing on time? Oh boy, it's already been an hour and 10 minutes. Well, I've done a bad job here. These were the things that I read through. These were my section titles in my literature review. Spent a lot of time talking about, like, is this a big deal? Turns out it is a pretty big deal, given the trends and the increasing healthcare costs and the commonalities of businesses, which is a perfectly rational decision to pass costs on to employees, therefore burdening them. You also get, I don't know, I'm not trying to shame health savings accounts, right? But you have some other alternatives to a standard managed care plan that if you pick it out and it's really not the one for you, it can expose you to some financial risk, okay? How to address it systematically. And I'll kind of just wrap it up on this, right? This was hard for me to think about until I stumbled across a paper that likened healthcare to higher education, right? In the sense that both industries have experienced increasing pressures, right? Mark Buck, what has been happening to college student enrollment over the last 15 years? Declining, all right? So we have a declining enrollment, declining matriculation, and so you got to do more with less, okay? Healthcare, it's not as much the revenue thing, but they're being pressured to do more and more and more, right? Both industries experience burnout. Burnout, not good for patients, as we talked about early. Who do we think on the Adams State campus that burnout is also not good for? Everyone's a good answer, but that's a lot of people. Well, it's definitely not good for the instructor. It's not good for the students, right? Because if you're student number 26 on my Excel spreadsheet, okay, that is delinquent on turning in an assignment versus this is Billy who just whose coach just got fired and they're freaking out, right? Like if I'm burnt out and I've now depersonalized my relationship with that person, right? Like I may be less likely to slide that Powerade over and say, hey champ, what's going on? Right? And that's just one case, and that's definitely from my own lens, right? But burnout's not good for higher education. I think that there's some things that we can do about it, and first of that is understanding a few different things. So I'll put together a survey, okay? That'll probably be what I end up, so the annual health fair does a really good job for us, getting a decent sized sample to address individual health risk factors. Goatsell, that same gentleman I was talking about, he identified 10 that were linked with medical claim spending. We addressed 9 of them through our employee health and wellness fair, right? The biometric screening that people come in and do tells us about these things. I'd love to do more with it, but that's a pretty good place to start, okay? This is the CDC Worksite Health Scorecard. It lets you take an inventory of the different workplace health promotion practices that already exist, like offering an EAP program. They're all over here. We have an on-site fitness facility. That's why that one's green. So we get to rank, or we get to evaluate, what do we already have existing on campus, right? Pretty crude tool, not perfect. Been validated, so I think that that's worth something. But so first thing, individual health risk factors. What are the resources that we have? My work has been with my recent survey to address the gaps that we have in assessment. So, put together a survey, purpose and consent. I asked you about employee classification. I wanted to know your preferences for wellness program activities, activity times, activity communication. I'm interested in this section right here. The literature told me that this was probably a pretty good idea. Barriers to participation, because I'm dumb, I'll go do anything. If there's something free in the break room, I'll go get it. There's nothing really stopping me. That's not the case for everybody else. Perceived health, environmental, and cultural wellness factors, right? Is it okay for you to take your breaks? Because I don't think it's okay for everyone to take their breaks culturally here on our campus, right? And that's not a shot. That's not like saying, but maybe we can do something about making that an okay thing to do. And then awareness of wellness resources. There's definitely things on campus that we have available that people don't know about, and I'm hoping my survey tells me about these things in a way that I can do something with it. I'm sorry for going over my time limit. I got excited. Does anybody have any questions for me? Vernon?
No.
You got questions?
We talk all the time.
Yeah.
So we'll talk when you get data.
Okay, we'll talk. Yeah, that's your T-shirt right there. We'll talk when you get data. Buck.
I'm not sure if this is accurate, because I have healthcare elsewhere, but somebody told me that here, we do not have a tobacco and non-tobacco plan.
I think that's the case.
Is it the case? You do?
I don't know. I think it could be the case that you might get some type of a discount.
Yeah, 'cause
But I'm also not this is a challenge for me. I don't use this health insurance.
And the reason I say that is, some of the institutions I've been at, it was you clearly paid significantly less for your
Okay.
healthcare. You're not a tobacco user. And I
Yeah, so you using carrot and stick as far as like, yeah, you play with the price of something, right? That may be the catalyst, right? Now, ideally, before you do that, you have yourself a nice, tidy tobacco cessation program already established to help support people. You've created the awareness around, hey, use your FSA to get Nicorette patches and Nicorette gum and use some of the other alternatives. And maybe you've even got the troops rallied around like, hey, AJ's quitting smoking, so we're going to give him kudos or something like that. But those are the types of things that I'm interested in exploring, is looking at not necessarily like, hey, what are ways that we could charge people more money if they're bad, right? But more into what are the details of our benefits? Are there opportunities for someone to maybe save some dough, or make some dough, right? Like both the classified insurance program and the Blue Cross Blue Shield program, they have a wellness program that's built in there already where if you do stuff, unless you're Alex, they'll give you stuff, right? And sometimes that's in the form of some type of monetary reward or incentive. My experience with those things is that I'm not a good payer attentioner, right? There's plenty of things around here, like I don't know what they are, how to work, and I'm not gonna go get them, right? And I think that you focus on some of those things, they're being reported on to our vendors who are supplying these things. Maybe we see a move in the needle as far as, the number of people that earn, that's a report that comes out, the amount of money that gets earned out of a wellness program, right? So, but that's one of the deals, is just parsing through all of this stuff, figuring out, making people aware of it, helping them out. And those are things that we have the capacity to do, right? And that's encouraging to me. Whether we can do them at scale, I don't know.
We do have a cessation program.
Yeah. Mm-hmm.
And really how that is, I guess, housed
Mm-hmm.
is through the policy on tobacco,
Mm-hmm.
right? There's a tobacco policy.
Mm-hmm.
However, it's more of like a 800 hotline
Yeah.
call in, and we do have also, I don't want to say hidden, but you kind of got to look for them
Yeah.
in the healthcare programs
Mhm.
that we have. Cessation is also there, but kind of have to know to look for it.
Mm-hmm. And that's tricky. Sorry. Yes, sir.
It seems as though you've got a great vision. You've got some support with the university. I wonder if there's any vision to reach out to the community that doesn't have the facilities that you have here at Adams State, and perhaps be a model or perhaps a partner.
Mhm.
Permit senior citizens in the gym on Saturday morning or something like that to expand a little bit into the community.
You got me hot under the collar, right? Because being the hammer that, the wellness hammer, like I want to do this thing for everybody, right? Because to me, like this probably ought to be a student's wellness initiative too. And I think that Adams State does have a significant influence on the community. Some of the things I did over at SLV Health, part of the angle was, look, like people ask you stuff, whether or not you should do this, whether or not you, like, sign up for the patient portal so you can kind of role model this. So I do think that there's an opportunity for any momentum that's created in here to branch out, hopefully indirectly, but maybe even directly benefit students, and then eventually looking into the community. But the most mature thing for me to probably do, stick with this group for a bit. But I agree with you. I think that there is an opportunity there. Other questions? You all have been super generous. Again, I apologize for going over my time limit. And thank you all for coming out and spending this time with me. You're the best. Thanks, Jared.